Hope your week is off to a good start. You're watching Arirang TV's special coverage on COVID-19. I'm Min Sun-hee. As of early Monday, Korea recorded 47 new cases, marking the first time in 46 days that the number of infections hit below 50. Accordingly, we begin today's edition with that headline, as I have Kwon Soa and Noaram here in the studio with me. Good to see you both.
Hi.
Good to see you.
So I will start with you. The number has hit below 50.
Right, and that actually comes right after the government's weekend pledge to bring that number down to 50. And this has now happened for the first time in 46 days. But we shouldn't put too much meaning into this figure alone due to a number of reasons. We had a number of changes to the time and frequency of COVID-19 announcements. And according to authorities, Monday cases have been lower for the past weeks, which can be explained by the lower number of tests conducted on the weekend. Vice Health Minister Kim Kang-nip said the changes throughout this week need to be closely observed. And the reason, meanwhile, for the government's efforts to bring the number of daily cases below 50 is due to that figure being seen as the point where medical and quarantine work can be more capably managed. Now, along with the 47 new cases, 3 more patients have died from the virus. 3,500 remain in quarantine, and almost 6,600 have fully recovered as of 12 a.m. this Monday. And 11 new cases emerged in the capital Seoul, 8 in nearby Gyeonggi-do province, 13 and 2 in Daegu and Gyeongsangbuk-do province, respectively. Most of these cases are related to cluster infections at churches and hospitals, as well as overseas transmissions, of which we also saw 16 new cases.
Right, and I understand authorities are calling on members of the public to abide by social distancing
Exactly,
measures.
yes. Over the weekend, the government announced to extend the strict social distancing measures for 2 more weeks, and that will begin today. So that decision came amid a similar pattern of daily COVID-19 cases, which has been observed over the past few weeks. Concerns also remain as 200,000 people were reportedly out and about this past weekend. That's 20% more than at the end of February. Also, the point of origin for 5 to 10% of all cases remains unidentified, meaning everyone's cooperation is still needed to draw an accurate infection map. And authorities also warned that an explosive spread seen in Europe and also in the US is still possible in South Korea, which could lead to a collapse of the country's health system and thus also to a surge in deaths.
Right, and speaking of the situation overseas, perhaps you can give us the figures from there as well.
All right, well, it's predicted to be a very tough week for many people in abroad, especially in the US, which Aram will probably go into the details later. But let's first take a look at the latest updates in countries with major outbreaks. The US, which accounts for a quarter of the world's coronavirus infections, has more than 335,000 confirmed cases and recorded over 9,500 deaths in a day compared to Friday. On Friday, we had 5,000 something deaths. Now, since Saturday, Spain's total cases are above Italy's, while Italy still has the highest death toll at more than 15,000. Now, Germany has surpassed the 100,000 mark in total cases, but still shows a low mortality rate. Meanwhile, the outbreak in Europe's epicenter, Italy, as well as the outbreak in Europe's epicenter, Italy, appears to be showing some signs of slowing down, and the same is also seen in the epicenter in the US, New York, which means some are predicting there may be a light at the end of the tunnel.
And we'll keep our fingers crossed for that. Thank you, Soa.
Thank you.
Now, Aram, last week we spoke about the return of Koreans stranded overseas. What's the latest there?
Yeah, so last week we saw some Koreans in Italy being returned home. Now we're seeing Koreans who are in India. They have arrived back home early this morning after they departed from New Delhi on Sunday evening local time. The passengers obviously had their temperatures checked and their health checked as well before boarding. And now that they're in Korea, they are undergoing testing for COVID-19 in government-run facilities. Now, as I mentioned last week, if no one shows any COVID-19 symptoms, then they will all still be required to self-isolate for 2 weeks. Even if one person tests positive, that whole group will have to be in quarantine in a government-run facility. The Korean embassy in New Delhi is also considering organizing a second chartered flight for any more Koreans who may wish to return back home. They're home to about 10,000 Koreans in India, and only a fraction of them have returned, so there could be more Koreans wanting to come back home. Elsewhere, meanwhile, Koreans in Hungary are scheduled to depart Budapest later tonight, so they'll be back soon. And some 2,000 Koreans in New Zealand will be coming back starting tomorrow, but gradually in groups.
I see. I also understand officials here are vowing to take tougher measures against those who violate quarantine measures.
That's right. The stricter penalties took effect from yesterday, in fact, and the previous law relating to these quarantine rules imposed a fine of up to $2,400. It is much higher and stricter now. Under the revised laws, violations can result in up to a year in prison or a fine of up to 10 million won, which is the equivalent of $8,100. So quite the jump. The same goes for anyone who lies when filling out these health-related documents or forms when entering the country as well, because we've seen some false documentation being practiced as well. Quarantine authorities say nearly 140 people have been caught violating the self-isolation rules, with over 60 of them being investigated by police, and that number is sure to increase. And in fact, a Taiwanese woman just yesterday was deported after refusing to pay for her stay at these government state facilities, as all foreigners are mandated to do when they arrive in the country. And this is in fact the first case in which a foreigner has been deported for violating these quarantine rules.
Right, I see. Meanwhile, over in the US, I understand US President Donald Trump is no longer downplaying the COVID-19 pandemic. He's taken a different tune, is it?
Yeah, so he's painting much more of a grim picture, I think. He's starting to realize the scale of the pandemic. He has warned in his latest press briefing on Sunday that the number of deaths from the coronavirus in the US could be on par with the number of fatalities seen in the First and Second World Wars. He added that the COVID-19 death toll in his country could escalate in the next 1 or 2 weeks. In his press briefing at the White House, he also said it was going to be, quote, a very, very deadly period. So he hasn't minced his words there. He didn't give any specific estimates on the likely death toll, however, but previously he did say that he expected about 200,000 deaths in the coming week. And the Trump administration has also extended its social distancing guidelines to the end of this month. But meanwhile, President Trump has again touted an unproven anti-malaria drug as a possible treatment for COVID-19, contradicting one of his top health officials who was actually leading the coronavirus task force in Washington, this Dr. Anthony Fauci that we've been hearing a lot of. And Fauci, in fact, maintains that there is no concrete evidence that this anti-malaria drug can actually treat COVID-19. So he's causing quite some controversy there, Mr. Trump.
I see. Moving on to another head of state, Britain's Queen Elizabeth had some words of encouragement. Yeah,
so she told the British people on Sunday that they would overcome the coronavirus outbreak if they stayed united and resolute, invoking the spirit of World War II, in fact. It is extremely rare for the Queen of England to give such a televised address besides her annual Christmas message that she usually gives. And Sunday's address was only the 5th major address, in fact, in her 68-year reign. So it kind of proves the gravity of the situation at the moment. And the Queen also thanked the health workers as well as other essential personnel. The monarch said this, quote, challenging time reminded of her addressing the nation in World War II when she was a teenager. She gave an address along with her sister during that time to kind of spark encouragement in the British people. And the royal family, of course, hasn't been immune to this COVID-19 outbreak. The heir to the throne, Prince Charles, is in self-isolation after testing positive recently. In the government, meanwhile, Prime Minister Boris Johnson has been admitted into hospital for testing, in fact, after he confirmed that he had the virus 10 days ago. But the 10 Downing Street says that this is just a precautionary measure and not an emergency one.
Right, okay. Arirang, thank you for that. Thank you. So again, we'll see you again tomorrow. It's time now for the regular briefing by the Central Disaster and Safety Countermeasure Headquarters. Today's briefing will be led by Chung Eun-kyung, the head of Korea's Centers for Disease Control and Prevention, whose calm and consistent comments on COVID-19 have reportedly created a credible character against the current crisis. Now, this is according to one foreign media outlet that this past weekend who highlighted the hidden heroes behind the outbreak worldwide. She's expected to call on the public today to keep their guard up. Despite the slowing rise in the number of new infections, Korea remains vulnerable to imported cases and cluster infections, the government believes. Accordingly, the social distancing measure has been extended to the 19th of April amid these concerns. Here now is the briefing.
먼저 정은경 본부장의 설명이
Here is
있겠습니다.
정은경.
Let us now begin our regular briefing on the coronavirus outbreak here in South Korea.
As of today, midnight, the total number of confirmed cases stands at 10,284, and this includes 769 imported cases from overseas. 92.2% were Korean nationals. 6,598 of the total, or 64.2% of them, have been discharged. And we had 47 new cases yesterday, and 135 more people have been released after full recovery. So we have seen a steady decline in the number of those who are on treatment. And the regional breakdown is as follows. Nationwide, 82.5% were related to cluster infections, and the rest, about 10% of them, are under investigation. When you look at the table that you have in front of you, 7.9% that is, was about related to imported cases, and about 80% were related to cluster infections, and 10.1% were the cases that are under investigation. The city of Seoul saw 11 new cases yesterday. Most of them were imported cases. And also we had cluster infections at the Manmin Central Church. And Daegu had 13 new cases, and it had one overseas case, but majority of them were related to nursing hospitals and nursing homes. In Gyeonggi-do province, there were 8 more people confirmed. Most of them were regarding the Ujeongbu St. Mary's Hospital and imported cases. And 7 have been confirmed at the airport quarantine. And as for the imported cases yesterday, we had 16 cases yesterday, and they were ranging from 13 from from America, and 10 from Europe, and none from Asia, and 7 were related to the airport quarantine, and 2 of them were foreigners. And most of them, 92.2%, were South Korean nationals, and the rest being foreign nationals. And as for the major cluster infections, when you look at the Ujeongbu St. Mary's Hospital in Gyeonggi-do province, the people who were on self-quarantine, 4 more people have been confirmed positive, and we have 43 people confirmed as of now. 16 were patients, 13 were staff and workers, and 15 were their families and visitors. And in the Daegu City, the second Miju Hospital, we had an additional case, as well as 1 additional case at the Hansarang Nursing Hospital. And in Ponghwa, after this person was released after treatment, this case has also been tested tested positive again. So we have witnessed 16 cases, similar cases in Daegu City, and the KCDC is currently carrying out epidemiological surveys on those who have been tested positive again. So they have been dispatched to the site. And what we are having in mind is that for those who have been tested positive again, we are collecting their samples and we are amplifying their viruses. So we are also conducting the blood tests. So we are seeing whether it's testing positive again, or whether it's a reactivation of the virus. And we are also trying to identify what are the reasons behind such reactivation of the virus. And 2 nurses who have been treating the patients at the Daegu Dongsan Hospital, as well as the Basan Hospital. So a total of 2 nurses have been tested positive while they were caring for these patients. And the person who was working at the Daegu Hospital, she was on self-quarantine when she tested positive. And in Masan Hospital, we are currently conducting quarantine as well as epidemiological investigations. And yesterday, KCDC has also announced guidelines on the prevention of infections by the medical practitioners. These will be made into effect very soon. So for the inpatients, we will be identifying their travel histories, and these will be shared by the database called DUR. And also abiding by the related laws, we will also mandate them to secure enough face masks that have a certain criteria. And also we will have preventive measures in place when they treat the inpatients, so that we can intensify the rules for the quarantine and preventive measures. And we will also provide them with preventive tools and equipment that are needed at the medical sites. And also for medical hospitals and nursing hospitals and nursing homes, we will provide consulting and consulting services. So for the comprehensive hospitals, we will connect them to other hospitals, and we are going to carry out consultations as well as providing necessary preventive measures. And we will have also by region consultative groups, so that they can help one-on-one consultations on facilities and hospitals that need help. And we will also have a special education and training and on-site monitoring of these health facilities. And together with Sejong City, relating to the Ministry of Oceans and Fisheries, we have conducted our epidemiological tests. And as for this ministry, they had very first suspicious case, and after that was identified, after 7 days, they have identified one confirmed case. And this led to secondary infections. From the 10th and to 24th of March, 39 people have been confirmed at the Ministry of Oceans, and 27 of them were the workers and staff members of the ministry, and the rest were their families and contacts. And after the first case has been confirmed, we were able to identify the early stages of confirmed cases, thanks to the shutdown of the facility and the buildings. And we also saw 33.3% of them were asymptomatic patients, and we are also carrying out further epidemiological investigation behind these cases. And starting from April 1st, we mandated a 2-week quarantine for all those inbound travelers. During the self-quarantine periods, we also advise them to minimize people-to-people contact, especially with family members, and sharing of the items, so that we can curb and decrease the risks of infections. And also persons who are failing to comply with the self-quarantine regulations, they are subject to imprisonment of up to 1 year or fine up to 10 million won. So we advise and we urge you to abide by the self-quarantine rules. And starting from today until the 19th of April, the government also asked the public to participate in enhanced social distancing. And so we advise everyone to stay home as much as possible and avoid any activities that can make it easy to come into close contact with others and maintain good personal hygiene. Thank you very much.
That was the Central Disaster and Safety Countermeasure Headquarters with the latest facts and figures on the COVID situation in Korea. There are 47 new cases as of early Monday here in Korea, raising the country's total to 10,284. Now, despite the relatively small increase in numbers, authorities here are calling on members of the public to abide by social distancing guidelines and to refrain from activities that put them at risk of possible infections. In this next corner, we delve into efforts in Sweden to fight the outbreak. Government officials there are gaining quite a bit of media attention for their liberal strategy to containing the coronavirus amid the policy of herd immunity. Now, recent hikes, however, in the number of infections and fatalities in the capital city, Stockholm, have medical experts voicing their concerns. For more on this, I have Kelly Kasulis, a freelance journalist based here in Seoul, with me. Hello, Kelly.
Hi, thanks for having me.
Now, perhaps we can start, for the sake of our general viewers, with what is meant by the term herd immunity and why you believe Sweden may have opted for this approach to fighting the virus.
Yeah, so herd immunity is really this idea that the healthy segments of the population should be allowed to go out and about and essentially contract this virus because they have a high chance of overcoming it. And the idea is that if enough of the population gets the virus and then becomes immune to it, that it will slow down kind of the spread of the virus. This is kind of a comparison. I mean, it's the same way that people try to reduce the number of mosquitoes, right? They release mosquitoes that are infertile, and then that helps lower the production of new mosquitoes every season. So it's kind of a similar strategy. In Sweden, it's interesting because, as you mentioned, we are seeing a rise of cases in Stockholm, and the country's chief epidemiologist has been, more or less accused of deploying this kind of strategy, this herd immunity strategy, and he basically denies that. And what we're seeing is that the country has not had that much for official measures telling people to stay at home. Cities have not been shut down, things like that. And so some experts in the area are basically calling for more government-instituted measures to prevent people from catching the virus.
Right, Kelly. Now, before we delve any further, let's take a look at some of the actual scenes in Sweden amid the government's policy of herd immunity. This video was sent by a Korean national currently living there.
Hello, my name is Isaac Chu from Stockholm, Sweden, and I'm currently 17 years old. It has been 50 days since the school has been shut down. From what I know, all the high schools or the upper secondary schools are mainly shut down right now, but I know that the primary schools are still open. So we're doing distance teaching right now, and that means that we have a sort of a video conference where the teacher has a lecture through a software such as Microsoft Teams or Zoom. Yeah, obviously in my personal situation, I have to study from home, and I know that my brother and sister also has to study from home. But my other sister, that's a doctor, she has to actually go to the workplace, but she's a doctor, and she has to help the people in need. And my other sister, she works at the drug department, and she used to work there at the workplace too, but since the government has prohibited from people gathering up to 50 people, she has begun to start working from home. I think before the atmosphere used to be really tense actually. People started hoarding toilet paper and pasta and those kind of stuff. But nowadays, well, I don't go out that much, but from what I know, people don't hoard that much these days. The stores usually, you can see that a lot of stores has begun closing a lot earlier and open a lot later, and even some stores have begun to shut down. Compared to other countries, it has not been shut down, so you can still do that if you want to. I mean, there is a clear tension in society right now, I think, and there is kind of worry about the future in between the population because, well, it's the first time that we experience a pandemic like this, and therefore we don't really know the optimal way, I suppose, to combat this disease.
Well, I suppose one advantage of the Liberal approach is that it's discouraged hoarding. Kelly, what are your personal thoughts regarding this herd immunity approach? I mean, UK Prime Minister Boris Johnson adopted it at one point before abandoning it amid widespread public backlash. What are your thoughts?
You know, I'm not a medical expert, but everything that I've heard as a reporter has not really been in support of this herd immunity approach. As you mentioned, the UK is kind of turning away from this now. Unfortunately, this COVID-19 virus is extremely deadly, and we're already seeing massive devastation around the world. Some would say it's a little reckless from a humanitarian perspective to be taking on an approach like that.
Kelly, I understand the Swedish authorities are now looking into taking tougher measures against the virus?
Yeah, I mean, so far some of the older segments of school children, like high school or college, are being told to stay home. There are some measures, you know, recommendations for vulnerable segments of the population. But I think still what I'm hearing and reading online is that doctors and, you know, the public in Sweden is urging the government to perhaps consider things like total lockdowns, only having essential businesses or essential workers out and about. Because right now the country is actually in a pretty decent state, but that could quickly turn, as what we've seen with Italy, France, the United States, and other countries.
Right, that is true, because Sweden has reported more than 6,000 cases, and the loss of lives there now stand at over 300 so far. What's more concerning is that health authorities are forecasting that about half of Sweden's population may be infected by the end of this month. Now, hopefully that will not be the case. Meanwhile, should you have videos that you'd like to share with us, do send them in. Movement restrictions to contain the COVID-19 pandemic have disrupted economic activity on a global scale. Now, for more on this reality, we have James Kim, chairman of the American Chamber of Commerce in Korea, in the studio with us. Welcome, Mr. Kim.
Thank you very much for having me.
And we also have our Kelly Kasulis still with us. Thank you for being here.
Yeah, thank you.
Now, Mr. Kim, how would you assess Korea's response to the COVID-19 pandemic?
You know, obviously there's a lot of praise about the progress Korea has made. We also published something called the Daily Tracker that walks us through all the progress Korea is making today on a daily basis. But as a business person, I always want to take a look at results and the performance. And when you look at the results in Korea, after being the second largest epicenter in the world today, we have, 10,000 cases, 64% recovered, a death rate of around 1.7, 1.8%. Those are really, really phenomenal numbers. Obviously, you don't want to lose anybody, but the fact that the rate is only 1.7, 1.8% speaks a volume about what Korea has done. We had a peak of 909 cases on the 29th, and today, in many weeks, we're now below 50. So we should all be very proud of what the Korean government has done, what the Korean citizens have done, and what the Korean companies and multinational companies have done to promote this progress.
Right. Mr. Kim, what has business been like for AMCHAM members amid this climate of crisis?
You know, I think you'll be a little surprised at my answer today. I'm in constant contact with all the member companies, especially the Board of Governors. And we have 30 Board of Governors, ranging from companies like FedEx to United to the Hyatt hotel business, Qualcomm, and so on and so forth. So we have the real big companies represented today. Obviously, all of us are following the guidelines from the Korean government. We want to be good corporate soldiers. We have postponed events. We're avoiding public gatherings. And we're giving every one of our employees the option to work at home. We also conducted a survey on COVID-19. And obviously, COVID-19 has definitely impacted businesses for everybody here in South Korea. But I think that although they are having some shortfalls in revenue today, I like to put them in three buckets. They're the companies like in the travel and tourism business. It's really, really tough for them. And I really feel bad. But at the same time, you have the ones in the middle and the other spectrum where business is not that bad. So I think that there could be the doom and gloom concept, but there's also a lot of optimism where we can all feel pretty comfortable that when COVID-19 goes away, we're going to be in a much better position to succeed, both in Korea and globally.
And we'll get back to that later on. But first, let's take our attention to the US, Mr. Kim, where authorities have recorded more than 335 cases so far. What's the current state of the economy there like?
Well, obviously, U.S. is in a pretty dire situation today. Every morning, when I, on my way to the office or at the office itself, I follow President Trump's daily press briefing. And you take away some of the politics, I think President Trump is doing a phenomenal job. Every morning, he's speaking to the U.S. audience about things that are going on. So I think he's really taking a strong line about leading from the front, walking us through all the good, the bad, and the possibilities, and showing some optimism. But I think that U.S. is a country with a lot of innovation, a lot of strong people out there. So I do feel that they will recover.
Right. And before we continue, let's take a look at this next video where we see some changes in the business arena amid the COVID-19 pandemic here in Korea.
The American Chamber of Commerce in Korea office located in Seoul. An important meeting is about to take place with around 200 representatives from member companies.
Looking at various aspects of the impact of COVID-19 on U.S. businesses in Korea and on the U.S.-Korea partnership.
Today's conference will be in the form of virtual webinar.
Many of these issues that you folks is going to continue to offer a series of these webinars focused on the various impacts of COVID-19 and how companies can adapt and thrive in this new environment.
AMCHAM is now using webinars to engage with its members since the COVID-19 outbreak began, replacing face-to-face meetings.
Most businesses, we've been practicing social distancing. As the American Chamber of Commerce, we tend to be a very face-to-face business. So we've been looking at other tools that we can use to continue to bring that kind of value to our members. That includes webinars like the ones that we hosted today. We've also been hosting smaller meetings online with our members. We've done a lot more communication by telephone, virtually, and in writing.
The office environment has changed since AMCHAM adopted a work-from-home policy.
Most of our employees have been working from home. We usually have just a few people at the office every day, only if there's some urgent business that really requires us to be here. In a way, it can even incentivize you to be more productive to show results.
The COVID-19 has resulted in a different work culture involving the use of virtual conferences, phones, writing, and other forms of non-face-to-face interactions. A recent survey in South Korea showed that 74.5% of all laborers were satisfied with working from home. Social distancing measures are also being practiced. Flex-time working hours have been adopted, allowing people to avoid rush hours. Many cafeterias now require workers to sit facing one direction and have even set up partitions. Seating has been rearranged to alleviate congestion in crowded office spaces, and 3-feet-high partitions have been set up. Office environments are undergoing radical changes as companies try to prevent the spread of COVID-19.
So as seen in the video, Mr. Kim, it appears that virtual conferences have become the norm. How are people responding to these changes in the work environment?
We launched the webinars because our member companies have asked for accurate, timely information that they could rely on. So we felt that because we canceled a lot of our physical events, we wanted to use the right technology to do a webinar. And we feel that a webinar is a great way to provide updated and informed decisions for our members. And I think it has been very, very positive. And as you know, a lot of our member companies are technology companies. So when we use their technology to do a webinar, it's been really, really a successful experience. Our first webinar we did last week with very little promotional campaigns had 175 participants. So we feel that a webinar is a new way to provide more information. But when you take a look at AMCHAM member companies, whether they're schools, Seoul Foreign School, or the Dwight School, they're already using the technology to do virtual learning. And when you take a look at a lot of our other member companies, such as AWS or Microsoft or Google or IBM, cloud computing makes it so much easier to facilitate these kind of virtual conferences, virtual meetings. And when you look at a company like 3M, another one of my member companies, they actually make masks and all kinds of other things that could be very positive on COVID-19. So we really rely a lot on the webinars to educate what US member companies are doing and how we can help the Korea ecosystem combat COVID-19 during these pretty negative environment today.
Kelly, I suppose similar adjustments have been made in the work environment in the US as well. Not only the work environment, probably the education environment as well.
Absolutely. I mean, schools have been closed down. I've heard from family members in the US that say they're going crazy because their kids have been home all day for weeks now. I've heard from friends and colleagues, they're all working from home. I have several friends and fellow journalists that I know in New York City who have escaped to other states and want to go back to that city where basically the US is having its biggest outbreak, and they can't. And we're seeing even in some towns, some states, that all non-essential businesses are being closed down. My parents' business in Connecticut is closed. It seems like right now a lot of people are out of work, not working at all, and if they are working, they're working differently than they were a few weeks ago, for sure.
Movement restrictions have been put into place, Mr. Kim, to combat the coronavirus, and this also includes travel bans between countries. What do you suppose is the impact of such restrictions on business between countries?
First and foremost, the U.S. did not issue a travel ban for South Korea. There's 4 levels that the U.S. State Department, really publishes. We're currently at a level 3 for most parts of South Korea, except for Daegu. So if you really wanted to travel, you could. But obviously, anytime there's a curtailment of travel, it's really not that good, especially from a business perspective. That's the reason why I am very thankful for companies like FedEx, Korean Airlines. What have they done? They have transformed the passenger-to-passenger mode of transportation to packaging or packages and other types of important goods, including medical devices and medical gear. So I think this is another way companies are transforming themselves to make sure that, although people-to-people transport could be difficult or limited, packaging, it's still going along pretty well today. And I'm very, very pleased that these companies have done such a great job.
Kelly, what's the public response like in the US regarding the entry restrictions or bans of travelers to the country?
I have looked for public polls on this and haven't found any, but I will say anecdotally speaking, observing what Americans are saying on social media as well as speaking to Americans, there's not that much sentiment against travel restrictions and travel bans. To be quite frank, I think much of the United States is in panic mode right now, and they want to do whatever they can to stay safe, to the point where I think this can even fuel a sense of xenophobia. So I think, on average, people probably don't mind a ban or don't have strong feelings about it.
During the G20 virtual summit, President Moon Jae-in called for exemptions to the travel ban for business people. What are your thoughts on this?
First and foremost, it's great that the G20 ministers got together and seem to have an aligned, view on how to handle this crisis today. But for us, taking measures to practice fair, free trade is really important for the long run. And the faster we can get all the economies working together in an aligned method is going to really help us over the long term. So I'm very happy that they're working together. I wish they can share even more information more quickly, with more transparency and more accuracy. Then we can help fight the virus in those countries that we know are coming. I see my map from the Johns Hopkins report every day, and you just know what countries are right behind Korea. I think Korea is now number 16 or 17 today. And I just see the rest of the countries in the world that are going to overtake Korea in the numbers. And that's where I think we need to do some real help.
Mr. Kim, just out of curiosity, where do you believe does the priority lie when talking about public health and economic stability? I mean, authorities are seeking a balance between the two. Where does priority lie, in your opinion?
Well, as a business person, obviously saving lives is the most important aspect, regardless of any economics. So I think having the right balance is very, very important. I mentioned earlier today, I'm in constant contact with 30 board of governors, and I place these companies in 3 buckets. Some are having really a catastrophic problem today. When your revenues are off 95%, there's not much you can do, right? But the ones in the middle, their revenue may be off 20%, 30%, but that's something you could transform. But there are other companies out there that are doing pretty well, right? These companies are taking a look at COVID and what they can do to transform their business model. A lot of companies that we know are going from offline to online. So e-commerce has done really, really well. So my whole thesis behind this is we have a healthcare problem today, which is severe, but we also need the economy to get back strong so that we could support, provide value back to the healthcare professionals that can help save lives. And we need to do that in conjunction as we manage through this crisis.
Meanwhile, Kelly, the jobless claims in America hit an all-time high. It's not looking very bright there.
Yeah, it's actually the highest declaration of unemployment to the US government in history, which is a pretty phenomenal, crazy thing to think about. The last numbers I saw, it's 9.95 million people have filed for unemployment, so close to 10 million people. It's so common that I myself know many people in that position. It wouldn't surprise me if many people that I'm connected with on social media are also out of work. And I think it does not bode well for the US economy. I mean, even within the journalism industry, I've seen major drawbacks on budgets because of a fear of a recession. And I don't mean to sound the alarm bell too much, but I do not know, and I don't think any of us can really know what the long-lasting impact on the economy will be, especially since we can't tell when this virus can be contained on a global scale.
That's true. Only time can tell, right? Mr. Kim, the trade ministers of the G20 also held talks, and they signed a joint declaration attempting to ease perhaps the economic fallout of the COVID-19 pandemic. What are your thoughts on that?
I think I mentioned that before, but when these ministers do get together and have an aligned view, I think that can help accelerate the progress that we're making today. And I think that Korea is really leading the way in how to accelerate some of the improvements in containing COVID. And I really like what Prime Minister Chung did over the weekend, where he talked about extending social distancing for a few more weeks. I think we can all be very, very happy with the progress in Korea. And I was just out over the weekend, and I'm seeing a lot of people not practicing social distancing today. I was at a food court, same thing. I'm looking at parks, a lot of people out there. So I think that Prime Minister Chung did a great job to reinforce that this virus isn't over. And although we should be celebrating that we are below 50, I think we need to be more vigilant than ever before.
Right, we need to be more cautious,
Yes.
of course. All right, James Kim, Chairman of AMCHAM, thank you for being with us today. And Kelly, again, thank you for your time.
Thanks.
And on that note, we end today's edition of COVID-19. Do join us again tomorrow at the same hour. In the meantime, Arirang TV welcomes your thoughts and inquiries through our social media accounts or our homepage, arirang.com. Thank you for being with us.